This podcast is meant for general health information and is not meant to override any medical advice. All questions will be screened and not contain any personal information. If you want a private consultation, contact us via positivechoice.org, or you can contact your provider directly. Thank you and enjoy the episode.
Hello, and welcome to the Positive Choice Wellness Podcast. My name is Melanie, and I'm an exercise physiologist.
My name is Kimberly, and I'm a registered dietitian.
My name is Brandon, and I am a kinesiologist and professor.
I was like, what's he going to say today? There's always something, always another title there. I love it. How are you doing, Brandon?
I'm good. It's good to be back. I really enjoyed recording podcasts with you and Kimberly, so thanks for having me back on.
Absolutely.
Yes,
We appreciate
thanks for
having
joining
you.
us.
Yeah, it's been a wild ride. And now we're in the new year, and it's time to get some fun topics back out there. And you're a wealth of fun topics, Brandon. This is why I like having you on, because Kimberly and I have been doing this now for a while, and we start to go, what should we talk about? And then Brandon comes along and says this. So
Yes,
that's
it's
kind of
perfect.
Nice. Yeah, we're grateful.
Oh, I'm glad that you're having me back on. I was a little worried that you don't like me anymore because it's been a while, but that makes me happy to hear that you both still like me and want to have me back on the podcast.
We like to have a variety of guests, and unfortunately the system we have doesn't like us to have more than 3 people at any given time, which kind of sucks, but we've tried to make it work as best we can. But at this point, you're not our guest, but you're here, so we appreciate you being here, Brandon.
Yes.
You're just with us, which is good. And what I think would be a fun place, actually, well, Brandon thought this would be a fun place to start, but I'm just pretending like it's my idea right now. A fun place to start would be, it's the new year, and a lot of folks are starting to think about taking care of their health, which, if you ask me, you could have started any time, but we know the new year is usually where people start to really think about taking care of themselves, getting back on track, doing the right things. And it also helps that all these holiday stuff things that have happened over the last couple of months have stopped happening, which gives us some space to breathe, I think, when we go out and do things in the real world. And for those who are thinking about maybe losing weight or getting on track with their weight, obviously there are ways you can do that now that are a little different than they've been historically. And one of those being GLP1 inhibitors, or those weight loss medications, that injectables that we have heard of, right? So Brandon came to us with this topic idea. It's very much not my idea. And he figured it would be a good one to start with, especially because it's the new year and a lot of people might be considering getting on these weight loss medication drugs. So, what are we thinking about talking today, like regarding these GLP1s, Brandon?
Well, I was thinking we could first talk about what the drug is and how it works, and then we could discuss muscle loss while losing weight on the drug. We can talk about exercise while on the drug, and some other things that happen, like bone density changes, changes in resting heart rate. Uh, There's, and we're going to be looking at the research to answer a lot of these things. I have some research articles up and ready on my computer
As
that
you
we can
always
get
do.
into.
Yay.
Okay, well, I think a great place to start would be, what the heck is a GLP-1 inhibitor? What
Yes.
is it? What does it do? Like, why are these all of a sudden all the rage right now?
So GLP-1 stands for glucagon-like peptide 1 inhibitor, I believe. And there's even longer ways to that. There's an RA, so, and I forget what the RA stands for, and this is also known as a class of drugs called incretin-based therapy, I think, or no, yeah, incretin-based therapy.
Okay.
So the way that these work is these medications affect the pancreas, and our pancreas has these cells in them called beta cells, which produce insulin or secrete insulin. So this drug helps boost insulin secretion, and then it also suppresses glucagon secretion from alpha cells of the pancreas. And I know that's a lot of big words, alpha cells, B cells, all that stuff. But basically, what everyone needs to know is that through that change in hormones, because this is how this medication works, it mainly works through changing hormones. The effect of that change in hormone ultimately slows gastric emptying, and
Mm.
reduces appetite through, again, reducing the ghrelin hormone, which is the hormone
Mhm.
we feel when we're hungry.
I always like to share a little story about ghrelin just because I was an intern when this happened and it stuck with me for the last 10 years. But I was in a class with Allie and she was teaching one of her fasting programs, the medical weight management. And some guy had commented, was just like, isn't there that a hormone, the gremlins in your stomach that make you hungry? And I like always think of gremlins every time I hear ghrelin for some reason.
It's
Yep.
amazing. I
The
learned it
way
in
I
a
learned,
fairly similar way. Yeah.
Yeah.
yep, the way I learned it was your stomach goes grr when it's hungry. So ghrelin.
Or gremlins. Or gremlins. Don't feed them after midnight.
That's
Yep.
so good.
Okay, so there's a medication that pretty much allows for appetite suppression and slowing of gastric emptying. So basically allowing people to feel fuller, and what I've heard actually is quiet down some of that food noise that makes us feel like we need to eat, this compelling drive. Am
Yep.
I wrong? Am I right?
Oh, sorry. Someone's at the door and it distracted me.
Oh.
Um, yeah, we forgot to. Thanks for bringing up the food noise part as well. So yeah, I've
Mhm,
heard that as well, that it reduces all of those thoughts of like wanting food and all that stuff.
mhm.
Yeah.
So the GLP-1s, obviously they're acting on our body to kind of help with this appetite suppression. It's helping us not feel as hungry. It's helping us, lose weight. So it can't be that perfect, right? Is there an issue that might come up with it? And I think it might be pertaining to probably what our field is, Brandon, but what are some of maybe of the problems with taking GLP-1s?
Yeah, that's a great question because the media makes it sound like it's this miracle weight loss drug, right? And
Mhm.
people hear that, oh, they can lose all this weight by just taking the medication. And
Mhm.
this medication does work. In fact, it can yield 15 to 20% weight reduction in adults, and that was only previously possible through bariatric surgery.
Oh, wow.
So in some ways, it is a miracle drug. This drug is a really powerful drug, but it's not a perfect drug. So some of the things to look out for while on this medication are going to be muscle mass loss. That's going to
Mhm.
be the first thing that is relevant to our field, like you mentioned before.
Just like
So,
hinting, wink, wink, nudge, nudge. What's the problem? No. But I
Yeah.
mean, muscle mass loss is, I guess, to add some context before I let you go in too deep, is really just to point out to everybody listening that regardless of how you choose to lose weight, that is a side effect, period. End of story.
mhm,
Now, GLP-1s kind of exacerbate that a little bit more so than other methods. However, it is a side effect of all forms of weight loss, regardless of how you choose to do it. Muscle mass loss is a thing. That is what happens. So to kind of let the baseline be there, how would GLP-1s be more detrimental, I guess, in that regard of muscle mass loss?
yeah, well, I used to think that it was a bad thing. Like you should never lose muscle mass while losing weight, or you're doing it wrong.
Mhm.
But lately, my opinion has been changing more to it is just a fact of life, like you
Mhm.
mentioned. And I have a study from, it's titled Preserving Healthy Muscle During Weight Loss. It's from the Journal of Advanced Nutrition in 2017. And what it says is that typically people can lose 20 to 30% uh, fat free mass
Oh.
of their total weight loss. Now, keep in mind that's fat free mass, that's different than muscle. Muscle is a part of fat free mass, right? We do these
Mhm.
body composition assessments where we teach this to our patients. But what I found in some of our journal articles is that for GLP-1s, muscle mass could be closer to 8% or 10%.
Mhm.
So that's a big difference from the overall statistic that I found in this research article. And they
Interesting.
also specified that the larger someone is, the less muscle mass they lose when they're losing weight. But the smaller someone is, the greater percentage of that weight lost is fat-free mass. And
Oh,
that is
interesting.
because people who have a larger body fat percentage, they have more body fat to get rid of, and their body will prefer to get rid of that body fat.
Mhm.
Whereas someone who is maybe just overweight, when they don't have as much body fat to lose, and so they may lose a little bit more muscle along the way. So I
Got
thought
it.
that was an interesting thing that I read from this study.
Yeah, that
Yeah.
is.
Yeah, and what you're saying, that it just kind of just makes me think about the fact that when people are like, I always say this to my classes, like when people are pretty overweight, like more than just overweight, they're like in the obese category or even more so, which does happen. I like to tell them, like, in a weird way, you kind of have a leg up over other people because you get to retain more muscle as a result of that, which is a weird comment to make. But what I do share with people, as we go through the weight loss process, our body doesn't want to, period. Like that body does not like to lose weight, does not want to do it. And as a result, it's going to fight us every step of the way. And one of the most effective ways it does that is by consuming our own muscle tissue as a form of energy. And
Mm.
it's definitely prevalent, I think, really obviously in any form of weight loss, but more so in these GLP-1s because it's pretty rapid weight loss that people are experiencing for the most part. But then the other thing to think about too is, like, as we lose weight, it's not just the fact that our bodies are eating away muscle tissue because it's trying to stop us, but also there's less of us. There's less of us moving around. Therefore, we don't need as much muscle to carry us from point A to point B if we lose like 50
Mhm.
pounds. So there's a couple of reasons why we're losing this weight or this muscle mass. And so it's interesting kind of to see this effect that GLP-1s are having on our bodies, which I feel like is a little not so great compared to just standard weight loss, other methods that we do outside of the medications.
Yeah.
Right.
And I remember we had a staff meeting about a week ago with Melanie, Kimberly, and I, and all of our team. And
Party
we
time.
had a presentation. Yeah, it was fun. Someone brought some really good pumpkin bread.
I have
And
no idea who that was.
It was a
and our
delight.
Yeah.
yeah, and our coworker Liz Kemp shared with us some data from a client of hers with pre and post data on her body composition
Mm.
after GLP-1 use. And what I did a little math in that meeting, and I
He did.
calculated that pre GLP-1, this woman had about 19% of her body weight as muscle mass. And
Mhm.
we got
Mm.
this data from our Sika body composition assessment, where you can learn this if you're interested. Post GLP-1, guess what her percentage of muscle mass was? It was still 19%. I mean, it was
Yeah.
literally off by like a tenth of a percent. And that just changed the way that I look at muscle loss because we don't want to look at it in absolute terms. If
Mhm.
we look at
Mhm.
it in absolute terms, it's like, oh my gosh, oh, we lost 7 pounds of muscle, and that's like 50 calories a day that I'm not burning. Oh my gosh. But then if you look at it relative to your total body weight, that woman was, I would consider her incredibly successful because she
Mhm.
retained relatively the same amount of muscle while losing that body fat.
To add to that, though, she did include more activity in her lifestyle. She went from not moving at all to then being very active. So I think
I
there
was
was a
just gonna ask
other
that.
aspect of that that also improved
Mhm.
her muscle mass retention.
Mm.
Yeah, and that is such an important point to bring up, and that is what we're going to get into today in this
Mhm.
podcast is we're not just going to talk about GLP-1s. We're going to talk about why exercise is so important. And
Yay.
that case study that we just discussed with this woman is the perfect example of why exercise is essential while being on this medication because you want to be like this woman. You want to take this medication and be successful
Mhm.
and exercise and not lose relative muscle mass.
Exactly. I would be in full agreement with you there because I think it's super crucial to maintain our muscle mass in general. It's naturally going to decline as we get older.
Mhm.
It naturally declines as we go through weight loss programs. Like there's a lot of things compounding against us to lose muscle. So I
Mhm.
think this is a beautiful topic to start with because although I may sound like a broken record, I'm appreciative that you can be the replacement broken record of telling people, please build muscle. That's important.
Yeah. And I
Yes.
would imagine, like, I'm sure we'll get to this, but I would imagine, if people ever choose to go off the medication or when they do, that would be an important habit for them to maintain, right? Even afterwards. Um, so that's
Yeah,
interesting.
that's
Okay.
right, Kimberly. Exercise has to be a part of the equation because at some point, people are going to be deprescribed or discontinue this use, and we want
Mhm.
them to maintain that weight loss. So
Yeah.
you're
Right.
right. Yeah.
All right. Well, let's dive into it, shall we? So, making sure we maintain our muscle mass. So, where do we want to begin with this, Brandon?
All right. Well, let's begin with a study that I have pulled up. So let me go ahead and get this up. All right. So I have a study here, and what this study looked into was the difference between combination of exercise and GLP-1 use
Mhm.
versus just GLP-1 use. And so what they did is they had 195 adults with obesity without diabetes go on and do this trial. This is a randomized control trial, which all you need to know about that is the best type of study you can do
Mm-hmm.
is a
And
randomized. Yeah.
yeah, and to add on to that, a study should have a minimum of 30 participants to be considered statistically significant in any form. So having that many people, pretty good, I would say, above
Mhm.
30. I like it. That's
Absolutely.
great.
Yeah, I mean, this reminds me back when I was taking research methods in grad school, and we would have to run the statistical analysis to figure out like how many participants we needed to
hmm
have results that meant something.
Yeah. So
Yeah.
192 people, right? That's a pretty considerable amount of people, and especially finding them all not having type 2 diabetes. That's an interesting thing that they were working on.
That
Okay,
is,
so
yeah.
Yeah,
large population.
I'm not sure why that was an exclusion criteria, but they yeah.
Probably because the GLP-1s were originally meant for people on or who had type 2 diabetes, who were on medications already. So I think they're looking to see the effects on people who do not have it because we don't have a lot of evidence about how it'll affect us and like what's all going on there. So I think that's probably why.
Okay. Yeah, that makes sense. So, what they did is they had 3 different main groups. They had the combined group, which was exercise and GLP-1, and specific medication here is liraglutide,
Mhm.
which is a GLP-1 medication. Now, there's several different kinds. Then they had the exercise alone group, and then they had the GLP-1 alone group.
Mhm.
So they looked at the results a year later, and here are the main results. So the combined group lost 6.1% abdominal fat. The exercise group lost 2.6% abdominal fat, and the GLP-1 group lost 2.8%
Interesting.
2.8% body fat. Sorry,
Interesting.
abdominal fat. Yeah, so
Hmm.
they were only measuring abdominal fat. I don't think they looked at total body fat. So I'm guessing they were looking at visceral adipose tissue as
That'd be
a
my guess.
yeah.
Right.
So that's pretty interesting. Like, what's the first thing that stands out to both of you with those results?
I usually tell my patients personally that exercise alone is not your saving grace in terms of losing weight. You can't lose a significant amount just exercising alone.
Mhm.
And it's usually more effective in conjunction with a healthy diet. And it's fascinating to kind of see how GLP-1s alone are almost identical to just exercise alone. Interesting. I didn't expect it
Yes.
to be that
Yes.
low.
I didn't either.
Yes, that was the huge
Absolutely.
thing that stood out to me.
Mhm.
And then here's another thing. I didn't mention what the exercise was that they did.
Mhm.
So they did 150 minutes a week of moderate intensity cardio
Oh,
or
wow.
75 minutes. They just did the basic recommendation that like we give to everyone. And so that was
Amazing.
interesting to me that like, wow, they didn't even do strength training to
Right.
like, yeah, it was just cardio. So
Interesting.
even just doing some walking, like, it's so powerful. It helps this drug be so much more successful.
Yeah, which I mean, that's kind of how exercise is with any form of weight loss. If you add it into whatever it is you're doing dietarily, it's gonna be better pretty much
Yeah.
across the board.
Mhm.
Absolutely. It's like missing pieces of the puzzle if you omit one, right?
Mhm.
Yeah, and I also think like, why would I want to take this medication and have potential side effects and it change the way my stomach works? Why would I want to do all that and not get the best results from it?
Yeah.
Right?
Absolutely. It's a good
I would
point.
so yeah, I would want to do everything I can to leverage the effect of this medication.
Yeah, definitely.
Yeah.
Yeah. So ultimately, the combined group did a lot better. They lost a lot more visceral fat. They reduced inflammation and also reduced cardiometabolic risk factors like blood pressure, blood sugar, and
Oh,
all that stuff.
good.
So big
Yeah.
takeaway here, exercise while on this medication, even if it's just moderate intensity cardio training.
Mhm.
Yeah.
Don't
I mean,
sleep on those steps.
I'm
Yeah.
never gonna argue against it, but I also, again, as I said, broken record. Now Brandon's the new broken record.
Yeah.
Well, interesting. Okay, so then
Yeah.
So obviously exercise is beneficial, especially in terms of burning belly fat is what we're finding, right? And that leads me to the next question of like, well, how is it in terms of muscle mass retention? Like, is there anything that can benefit us in that regard, as far as or statistical studies out about this? Like, is there any results leading to us believe that maybe strength training would be beneficial?
Well, it's
Mm-mm.
really interesting because I tried to find I searched in strength training, I searched in resistance training, all of those keywords on PubMed with
Mm-hmm.
GLP-1 and all that stuff. And I was really shocked to find that almost all the exercise interventions were extremely ambiguous and extremely basic,
Oh,
like what
okay.
we just shared.
Yeah.
The next study I do have is a little more specific,
Okay.
but like really, there's not a lot of research out yet that specifically tests different types of exercise interventions on GLP-1 usage. So I think the best guess we can have right now is what does the data say and the research say on just normal weight loss?
Mhm.
And what that shows is that combined strength training and cardio
Mm-hmm.
is the best.
Yeah, I would agree with you there.
Yeah, because at the end
Absolutely.
of the day, whether you're on GLP-1 or you're in a caloric deficit, you're you're in a caloric deficit in both situations, you're losing weight. So
Mm-hmm.
we could just refer back to the research we have on regular weight loss without the drug.
That's
Okay.
good.
Yeah.
I'm wondering, Brandon, from a research perspective, do you think any of that has to do with like maybe not everybody, right? But maybe the majority of the patients who are on GLP-1s don't have or haven't strength trained in a while or don't have a background in it. So maybe the goal is like just get moving, right? Like whatever that looks like, take baby steps in the direction of movement. I don't know. I'm just like trying to think of why there would be a gap there.
I think it's because um, it's a new medication. Well, it's been around for a while. Like I
True.
just typed in GLP-1 and there are some search results in like the late 90s is when it kind of starts,
Mm-hmm.
but that's super, super low.
Yeah.
Hmm.
But it starts to pick up around 2012, and then it really picks up in 2021. And then 2024, there was like the most amount of studies there's ever been on
Yeah.
this
Sounds
medication.
right.
So I
Yeah.
think that's really the main reason is
Okay.
when you start studying something new, you really start bird's eye view. And then once it's been around for a while, then okay, let's see how strength training compares against cardio.
I'm
Fair
sure a
enough.
study is in the works right now, probably that we don't even know about yet. So
Hmm.
at least that'd
Yeah.
be my
Hmm.
hope because it does feel like a very empty place in the research field right now as far as data. So
Right.
Yeah. So, and maybe I didn't put the right search results in. Maybe there is something. So, if someone can find a study on strength training
yeah.
intervention, let
Mhm.
us know. But until
Yeah.
then, we're just going to treat GLP-1 patients like weight loss patients and use the
Yeah.
data we have already.
That's
Which
good.
in fairness, the results are almost identical to what you would expect in any other exercise intervention anyways.
Yes.
So like I could see how
Right.
this would probably line up with what we would expect it to be. Yeah.
Exactly. Exactly.
Well,
All
any
right.
other
Well,
interesting studies for that then?
yeah, I have another study that I wanted to share. So, I like this study because were very specific on their exercise intervention.
Mm.
So, again, this was another randomized control trial from, and this is titled Healthy Weight Loss Maintenance with Exercise,
Mm.
Liraglutide or Both Combined. And this is from 2021 from the New England Journal of Medicine. And the specific exercise intervention that stood out to me was they did 30 minutes of high intensity cycling um, and 15 minutes of a circuit strength training session. So that's a
Oh,
45
nice.
minute session led by or supervised by an exercise physiologist or a master's degree student in
Oh, nice.
kinesiology. So this group, they got not only exercise, but supervised.
With like
And
really high quality people. That's actually really
Hmm.
awesome.
That's
yes,
great.
yeah, and this was high intensity. So they're not just going at a low intensity and
Hmm.
15 minutes of strength training circuit. And I looked at the exact exercises too, and it's just basic things: lat pull down, a lunge, a chest press machine, like just very basic things.
Mhm.
So I'm
Okay.
like, okay, cool. We got a little strength training represented in there, 15 minutes.
Better
So
than nothing.
the
Yeah.
yeah. So those that were on the exercise group, they did this supervised session twice a week with a professional, and then they also did 2 individual sessions a week on their own with just moderate cardio. So that's the intervention there. So again, we have 3 groups. We have the combined group, the exercise only group, and the GLP-1 only group. All right, and then let me take a look and see. We have how many participants? 100 and this one is 195 also.
Good.
So that's kind of like a coincidence, but they're not the same study though, I promise.
But that's a
Um,
good amount of people to have in a study. I always like to see it when it's in the hundreds range. I'm like, oh, significance, yay, or not. But I mean, whatever the results are statistically significant.
yeah, exactly. And I'm looking at the authors, and a lot of the authors are in the same in these 2 studies. So I think they replicated
Probably.
um, a lot of the methods is probably what I'm
Hmm.
thinking. So, anyways, what happened is that again confirms a second time that this strategy of combining exercise with GLP-1 improved weight loss maintenance after the treatment. So let me get to
Nice.
the specific results. The combined group lost 9.5 kilograms. The exercise group alone lost 4.1 kilos, and the GLP-1 group lost 6.8 kilos of weight.
Oh wow. That's a decent amount of weight. And over the course of a year is what this is?
Yeah, this was after 1 year.
Okay. So if we do the math on these kilograms, the combined group lost a little over 19 pounds, give or take, it seems. Exercise group lost a little over 8 pounds ish, give or take, maybe even 9. And then the GLP-1 lost like 13, 14 pounds. So that's pretty good. I mean, weight
Mhm,
loss wise for the combined group, that's basically almost 20 pounds right there. That's awesome.
mhm. Yeah, and, like, some other details that are important in this study is before they even ran the intervention, they all did an 8-week low-calorie diet, like, all 3
Oh,
groups did, and they all
okay.
lost, like, I think on average, it said, like, 16 kilos at first from that. Wait.
Oh, wow.
Yeah, so they all like, all groups did the diet, and they all lost on average 8% lean mass from the low-calorie diet.
Okay.
Okay.
So typically in like research, low calorie or very low calorie is around like 800 calories a day
Hmm.
Yeah.
or
Hmm.
1,000. So that's
Okay.
just one thing to be aware of. If your calorie intake is that low, is there will be more lean muscle mass loss the lower your calorie level.
Makes sense. The body
Yeah.
starts to eat yourself to make up for those calories that you're not getting in your diet.
Hmm.
Yeah.
Well, this is also fascinating stuff. I really do like the research aspect of this. It's really great to kind of see there's studies that support our fields. Hooray.
Hmm.
Uh,
Yeah.
but also, I think the bigger question now is because, like, I think we can conclude here that obviously exercise is helpful in promoting more weight loss should you be on a GLP-1 medication. Now, what happens when you're deprescribed said medication and now you have to be on your own? Now what?
Great question, because everyone's not guaranteed to be on the drug depending on their coverage or as their health changes and maybe their doctor makes a decision that they don't need to be on it. Who knows? There could be so
Mhm.
many reasons why someone may need to be off of this drug. And I have a study from the authors are Jensen and Blonde, and it's from 2024 from the Journal of Clinical Medicine. And one thing that stood out to me right away is they said that nearly 2/3 of the weight lost is regained after 1 year when you are off of GLP-1s.
Oh, wow.
Like,
Wow.
whoa, that came back quick.
Yeah.
Right.
I
Yeah,
can see
pretty
people
much
being a little
follows.
frustrated with that.
Oh, yeah,
Yeah,
absolutely.
yeah, and that pretty much follows the expected weight regain of getting off of a low calorie diet as well.
Mhm.
That's true.
Like, I think
Yeah.
in our berry class, we have a slide that says that 70% of people regain the weight back within a year or something like that.
I think
Hmm.
also another thing too is it only 18% of people with bariatric surgery keep the weight off. It's a pretty low statistic.
Yeah.
But I guess so okay, so 2/3 of the weight that they had lost I wouldn't say it comes back. It's different weights, just they regain some of the weight that had been lost. And then what do? Right? Like now there's this panic of like, oh no. So like how can we prevent
Mhm.
that? Or if you're in that position, what do you do? Like this is the question of the ages, right?
Yeah.
Because you can't be on these things forever.
Yeah. So this study from Jensen and Blonde that I mentioned, they wanted to investigate the effect of weight regain for people who exercise while on the drug and people who did not exercise on the drug. And what they
Mm,
found is that for those who exercised while on the medication, they maintained a weight loss of at least 10% 1 year after discontinued use.
that's fantastic.
Wow.
Yeah, it's pretty good.
Yeah.
Um,
Mhm.
For some
and
people, like be like 20 pounds. That's still a good weight loss to maintain. That's awesome.
Absolutely.
yeah, and think about like the cardiometabolic risks that are lower now because if you
Hmm.
lost 20 pounds. Like we're not
Right.
just losing weight because we want to look different or look better. It's it's extending our life.
Yeah.
Yeah.
I mean, it goes to show you too, like with exercise, it really does benefit us in more than just, moving to move. It does a lot systemically that really helps us feel healthier, behave healthier. Like we just generally have healthier habits the more we move.
Mhm.
And generally speaking, the less you move, the less healthy habits you tend to have. So it's good to see and validating to see that. But I think a good question is like, did the researchers have a speculation as to why that might be the case? Is that something that they were speculating on? Why that these people had better results if they had exercised with the GLP-1s compared to those who did not?
I don't know exactly. Um, I could
They don't always
get
have to
in. I could
speculate. I was curious if they
dive
did or
into the
didn't.
discussion and see, but um, they also found in their results that the GLP-1 only group that did not exercise, they regained on average 6 more kilograms more than the exercise group 1 year
Oh,
later.
wow.
Oh,
Well,
wow. Okay.
So they're just
12-ish
gaining,
pounds.
Yeah.
yeah, they're gaining a lot more weight back.
Wow.
And other studies have also validated this idea too that for some reason, exercising while on the drug will help you maintain that weight loss when you are off of it. I looked at
That's
multiple studies that confirm that, and they found best results for people who exceed the 150-minute a week guideline.
I mean, I
Who
always tell
exceed it.
people so like so for to understand the 150-minute a week guideline, that's the ACSM American College of Sports Medicine guidelines on exercising a minimum cardiovascularly of 150 minutes of moderate intensity exercise per week. So, of course, of
Mhm.
7 days, divvy it up. And I always tell people that's the bare minimum. That's not
Mhm.
Mm,
like the goal. That's the bare minimum of activity we ask you to do, which I know
Mhm.
feels like a lot. But
yeah,
it's interesting to see that people who did more had better results. It's like what I talk
Yeah.
about to people.
yeah,
More is better when it comes to exercise more often than not. There are reasons they can be excessive, but for the average person, we're so far from working out excessively. I wouldn't stress about it. You'd have to do a lot of
Totally.
exercise for that to be the case. So I like
Yeah.
this. More is better. This is good.
yeah. And I'm looking at a figure in this study that I opened up, and they actually found that the exercise group had less self-reported time sitting than the liraglutide only group.
Oh, nice.
So it's kind of like
Interesting.
moving your exercising more, like you're going to be inherently sitting less. Like
Yeah.
Right.
not just because you're using time to exercise, but because you're more active, you have more energy, you're able to move around more. Like I'm standing up right now, like this whole
Mhm.
podcast. So that seems like a really cool additional side effect of like exercising is like you're not just going to burn the calories from exercise, but you're not going to feel like sitting down all day if
Yeah.
you
Yeah.
exercise.
It's like it's a weird concept, but the more you move, the more inclined you feel to move. It works.
Mhm.
It's such an odd thing, but it really does happen where if you start moving more, you're gonna want to move more. It works on the brain
Yeah.
that way. It's kind of great, actually.
It's a positive snowball effect.
Yeah, a positive snowball effect. It's a good thing, not a bad thing.
Exactly.
So I think to get the gist of the entire point of this conversation is move. Is what I'm
Yeah.
hearing. Get some exercise in.
Love it.
Exactly, and there's, like, 3 more little reasons that I thought would be cool to talk about why we want exercise while on this medication, and these will be a lot quicker because I know we're probably getting ready to wrap up,
It's almost
but,
that time. Almost that time.
bone loss, alright? So I found a study that showed that People lost bone mineral density while on the medication without exercising, but
Mm,
those that did exercise did not lose bone mineral density. Boom, we got another reason. Here, second reason number 2, resting heart rate. People's resting heart rate
Mm.
increased while on the medication. So that means their
interesting.
Wow.
heart basically had to work harder, beat more to provide their body the blood supply that they needed, the oxygen supply. But if they exercised, they had a lower resting heart rate. Okay,
Wow.
third reason, self-perception of health. So people who take medications, sometimes they reinforce this belief that they are unhealthy because they are on a medication. And
Hmm.
that leads to decreased lifestyle change and a downward slope. It's like, oh, like poor me, I'm unwell. I'm sick. I
Mhm.
have to take this medication. And that has also been found in people who take GLP-1s. They kind of have a poor perception of their health. But for the groups that, or a study where they gave them exercise, those people did not have those thoughts about themselves that, oh, I'm sick, poor me. Um, I need this medication. They had a positive view of their health, a
Interesting.
positive perception.
I love that. So even like from a mental health perspective.
Exactly.
It's interesting you bring that up because a few years ago we had a research share and there was a study someone had brought in about it's kind of related to what you're talking about actually, where people of various different generations and age were comparing themselves to other people, their peers of similar age groups in terms of their physical fitness level and physical, how they were doing weight wise. And they found that the people who compared themselves to other people and felt that they were not as good tended to die younger than those who did not. So
Wow.
it goes a lot for self perception in terms of how
Mhm.
you live your life. It really does have a huge effect on a lot of things, apparently. So, I think that's important. You're bringing that up is people who moved more had better self perception of themselves too. So I think it's a kind of a combo deal. Don't like to point out the GLP-1. Don't think you're a failure because you have to get on a medication. That doesn't mean you're broken. There's something wrong with your whatever. It's just a different way
Mhm.
to lose weight. That's totally fair.
Mhm.
Don't
Yeah.
compare. Apparently, comparing is bad. Don't do that.
Absolutely.
Yeah, there's this wise saying from someone that I know that says, when you live in compare, you live in despair. And when you live in
Mm.
despair,
Ooh.
you die young, apparently.
Okay. We
There
tied
we
it all
go.
together. All right,
I
we're
know I was gonna
done.
say.
See you
Beautiful.
later. It was a good podcast. That was great. No. No, but that was a really good quote, Brandon, actually.
That was, yeah.
Thank you.
Well, we appreciate you coming on. This was awesome. I'm glad you can kind of talk shop with us about the medications and kind of the effects of exercise on them because, it's up and
Yes.
coming. There's a lot of research coming out. It's always great to hear the new studies that are popping up. And, hopefully maybe this year we'll see more studies coming out of the woodwork involving strength training specifically. And then we can really talk about strength training and beat broken records because I'm always about that.
Yeah. Do we
Yeah,
want
thank
to
you, Brandon.
end
I
with
learned
a?
a lot.
Oh yeah, you're so welcome. Do we want to end with a quick message from our sponsor?
Oh, yeah. Are you our sponsor? You sponsoring our
Oh
podcast, Brandon?
no, I'm just kidding.
We don't have ads. We don't want to do that to everybody. But me being kind of an ad. So thank you all for listening today. And, make sure you like, share, subscribe. If you're watching on YouTube, feel free to comment below. We work with people all around the country. So you can always hit up Positive Choice by going to positivechoice.org and checking out our services.
Heck
We are fee for
yes.
service, which means you do not need to be a Kaiser member. So tell your friends, tell your family. But with that being said, until next time, everybody.
Bye.
Bye.